You've been feeling differences a few days after ovulation, a few cramps, a little bloating, or maybe a tiny spotting, and now all you want to know is that, can I take a pregnancy test yet? Will it show? Or is it just too early to take the test? You've googled how soon after implantation can I take the test? Or maybe you've seen our video on implantation and you already know that implantation is the first sign that pregnancy has already begun. I know this can be confusing, overwhelming, and honestly, it can break your heart if you test too soon. And a lot of women think that the moment you see implantation bleeding, it's time to take the test. But the truth is, your body needs time to build up the pregnancy hormone called HCG before it can be detected in your pregnancy stream. That is why in this video, I'll be explaining exactly how implantation happens, how fast the pregnancy hormone HCG build up, the exact days to test for the most accurate results, and testing mistakes to avoid. I am not Sandra, and on this channel, we'll talk about understanding your body, your health, and your fertility. And if you haven't already watched our video on how to know if you're pregnant or if it's your period coming, and the other one on how to differentiate implantation bleeding and period bleeding, please do well to see them after this video, because this video is more like the next step after those ones. Now, what exactly happens during implantation? Implantation usually happens 6 to 12 days after ovulation. This is when a fertilized egg attaches itself to the wall of the uterus, and that is when your body begins to produce the HCG, that's the pregnancy hormone. But in the first few days after implantation, the HCG is still very low, too low for some home tests to detect. So what you really should know is that implantation is the beginning of pregnancy, but not the best time to take the test. Now let's talk about the second part, which is how fast the pregnancy hormone, the HCG, builds up after implantation. Your HCG levels doubles every 48 to 72 hours after implantation. So if implantation happens on the 8th, HCG might reach detectable level by day 10 to 11. But even then, the lines might be too faint to notice. Most women usually get clearer test results between 12 to 14 days after ovulation. So don't rush. Give your body about 2 to 4 days after implantation before taking the test. If you're finding this helpful so far, please hit the like and subscribe button so this video can get to a lot of women out there. Now, what are the best days to test after implantation? Let me just break this down clearly. If you have a regular cycle, let's say you have a regular 28 or 30 day cycle, the best time to test would be 1 or 2 days before your next period or on your expected period day. That is when you'll get the most accurate pregnancy test results. Now, if your cycle is irregular, just aim for 14 days after ovulation and not based on your calendar days. Now, let's talk about a few signs to look out for before taking the test. Just watch your body for these signs first. The first one is breast tenderness that feels different from the usual one you usually have before your period. The second one is creamy or sticky discharge. The third one is strange taste in your mouth, like metallic taste in your mouth. The fourth one is sudden fatigue. The fifth one is mild nauseousness or food aversion. You suddenly don't like to eat the food you usually love to eat. Watch out for that sign. And also a strange pulling or feeling in the uterus. If you feel these signs around day 10 to 12 after ovulation, it's okay to take a pregnancy test, but with a sensitive pregnancy test kit. These signs are soft whispers of pregnancy, but they are only confirmed if HCG builds up. One common question women ask is, what if I get all these signs and the test result is still negative? Now, the thing is, even when you get the signs and your HCG hasn't built up yet, you might still get negative. So it's always better to allow HCG build up. Give it a few more days before taking the test again. You can just give it about 2 to 3 days more before taking the test again. And if after you've waited for 2 or more days and you still get a negative test result and your period still doesn't show up by day 30 to day 32, then consider taking a blood test or speak to your doctor. First negative test results are common, especially when you test before your period. Pregnancy doesn't always announce itself with a loud sign. Sometimes it starts with a whisper. That is why it is important for you to understand your body and know exactly when to take the test. That's very important. If you felt implantation signs or suspect you're pregnant, just give your body some time. You can wait 2 to 3 days after implantation before you take the test, or wait till a day or 2 before your next period, or on the day your period is due. And remember, a negative test today doesn't always mean you're not pregnant. If you're feeling some way and you still don't get your period, do well to speak to your doctor or take a blood test. Just stay calm and be kind to your body. If you've watched up to this point, I just want to say thank you and I love you so much. Please hit the like and subscribe if you haven't done so already. If you have any question, any contributions, please drop them in the comments section. And always remember, your health is your wealth. Little changes makes a big difference. Thank you for watching and see you in my next video. Bye.